Okay, so today I am here with Dr. Angie Rumaldo, and I think we met at the Psychotherapy Networking Symposium earlier this year. Is that right?
Yes, and I had met with you to discuss more information about integrating neurofeedback in the practice.
Right, right. And so we've been in touch a little bit, and since then you told me about your project called Understanding Your Child and Teens Behavior, Simple Steps and Resources to Guide You Through the Journey. So I thought that was pretty interesting. And I thought since a lot of my clients work with young people, it would be interesting to talk to you about the project. So I'm just gonna read your intro so the audience will know a little bit more about you.
Sure.
So, Dr. Angie Romaldo has over 15 years of experience working with children, adults, and families. She has a growing and thriving practice in Manhattan and in the Bronx, New York, for those of you who are not in New York. She provides psychiatric and psychological services and has presented on mental health issues throughout her community in the Bronx and Manhattan. She's helped individuals, families, and couples to arrive at the solutions that work best for them. She has accomplished this task by helping the client come closer to their goals, needs, and help them arrive at a sense of peace. Dr. Romaldo's clinical experience and book provide real world, time tested strategies. She's a warm, inviting, accepting attitude that helps the client or reader learn and gain her expertise, and extensive knowledge in a no-nonsense way. Um, so the project Understanding Your Child's and Teens Behavior is a simple steps and resource guide to guide you through the journey. Provides parents, caregivers, and mental health providers with the tools they need to improve communication, recognize the need to act, and better connect with your family and yourself as a parent through a series of action plans. Understanding your child's and teens' behavior helps kids correct common behavioral problems before they inflict lasting damage. With insights into typical issues at each phase of an adolescent's growth and development, you'll learn red flag behaviors early on and develop a plan to fix them. So that's the tough part for me, reading through all this stuff. But it's better for me to read that than to just try to ad lib it. And I think it's helpful for people to have that background. So the first thing I guess I want to ask is, what made you decide to write the book?
Well, generally, I think that parenting is very overwhelming. And I wanted to really create a guide, a resource that can be utilized to help look up any concerning behaviors and really help empower parents or caregivers to quickly decide on what to do, when to act, and what to investigate. So really it's about helping parents get empowered, and I do that by providing an action plan, a simplified action plan.
Interesting. So again, as I mentioned, a lot of my clients are healthcare providers. Many of them are therapists and various types of therapists. They could be psychologists, psychotherapists, social workers, and so on, mental health counselors. And a lot of them are working with young people that have issues like attention deficit and hyperactivity disorder, anxiety, um, OCD, um, and various issues like that, where they tend to be using biofeedback and neurofeedback as a tool. But of course, I think most people understand that it's a tool, and there are many other things that are needed when you're dealing with these kinds of problems. And often people are coming in, if they have a young person that is has been diagnosed, let's say with ADHD, they come in and they might think that neurofeedback is just going to solve it, just do X number of sessions and that's it. But I think what a lot of the things that you get at are the many other things that are involved and that need to be addressed. So I think that's really important.
Yeah, absolutely. It's really about the entire picture. And part of the action plan is exactly that. It's really looking at different pieces of your parenting, the child's environment, the school, etc., to really develop a comprehensive plan, which will include your mental health provider, but really everything else.
Right. This is in a way it's not connected, but I was at a meeting at the high school yesterday, and there were a couple of it's a board meeting for the teacher center that I'm on the board of, and there were a couple of people before the meeting started, and they were talking about glasses, wearing glasses, and one person said that they uh, found out what they thought was kind of late, that their daughter needed glasses, and they almost embarrassed to say that, how long was this going on, and they didn't see some of the signs maybe where they should have been doing something. So I wanted to ask, there was something that was related to children that are picky eaters, and so as sort of a sign that there may be some issue that needs to be dealt with. So you want to say something about that?
Sure. I mean, that's a great point. That is exactly one of the purposes of the book, which is really raising awareness. Parents may notice what may seem to be benign signs or behaviors, and they don't really follow up until maybe it's delayed. And the sooner we're able to get resources or glasses for your child, the better they'll do academically, the better they'll
Right.
do with overall self-esteem. So really the book is about self-awareness, really looking at everything that's going on with your child.
And like for instance, the picky eating, what would you associate that with?
Okay, so picky eating can be a few things. One of them, for example, could be an early sign of sensory deficits. It can also indicate early signs of autism. So picky eating is really can lead to many other pieces.
Okay, and other signs that you would suggest people kind of pay attention to?
Poor eye contact, tippy toeing, a child that is extremely energetic, always all over the place, touching, um, temper tantrums that are occurring often, almost every day, or at least 3 to 4 times a week, that are excessive and usually over the age of 4, frequent stomach aches or complaints of like physical ailments. Those are all signs that happen every day with children and toddlers, but if you're seeing it happening more often than not, then it's definitely something that needs to be looked at.
And you feel it's important to address it early on.
Yes, because prevention is key. So the moment that something is recognized, ask questions, ask providers, go to your doctors, follow my action plan,
Hmm.
to really determine what needs to happen, because the earlier services start, the better their outcome.
Hmm. Great. And so you mentioned like the providers and so on, and also in your program and your book, you mentioned about partnerships. And what are some of the types of partnerships that you would say that would be important for parents in to sort of not feeling like they have to do everything themselves or fix everything themselves?
Sure. Really, everyone around you is a potential resource. So, partnerships with your teachers. Often, parents get mad that teachers are possibly picking on their children, but really, I challenge you to think, well, that's fabulous that they're recognizing your child.
Hmm.
And so teachers can be a really good resource. Your community centers, your priest or any parishes that you belong to, parents. that have children your age or have had children your age, your mental health providers. These are all partnerships that can really help you be better in parenting.
Right. You also mentioned something about facing your fears. What would you
That's
say
a good
about that?
point because I think a past potential difficulty in accessing help is the fear of, there are a lot of fears that go on, and I'll briefly talk about three of them. But one of the fears are, for example, is of talking to a stranger about your intimate details. So it's kind of like, oh, I really don't want to disclose this information. This is private information. But really, in disclosing information, you're acquiring information. You're acquiring further information to help you. And if you're disclosing information to a mental health provider, for example, everything specifically is confidential. So we're not at liberty to discuss your information unless you give us permission. So really, and we're not there to judge. So mental health providers are really a good resource as well because we're completely there for you.
Right. Do you find, as a mental health provider, that people are it's sort of related to that, hesitant to seek help from a mental health provider because
Yeah,
of stigma, let's say?
absolutely. I think there's a lot of reasons why clients or potential clients don't seek mental health providers. One of them is the stigma, and I'll talk a little bit more about that. And the other one as well is that I didn't mention that I wanted to mention is fear of receiving a diagnosis and fear of getting a record.
Right.
So my experience of clients who come here and do not want to get a diagnosis or are afraid of getting a diagnosis is that once a first off, not all providers give diagnoses. There may not need a need for that. But for those that do get a diagnosis, there's a sense of relief. Ah, I understand. I understand why I'm behaving this way, or I understand why my child is like that. It's not that he's trying to be difficult.
Right.
This is happening. So really the fear of the diagnosis, once you come and speak to a therapist, I think you'll find that it's mostly really a sign, it's going to give you relief.
And what would be the negative thing that a person might really be worried about as far as the diagnosis, and sort of having a record?
Okay, exactly. So the piece about the record is the belief that it's going to follow you, that it's going to follow you from school to school, from work to work, or that you may not be able to get work because of this diagnosis or of your mental health sessions. But really, in reality, diagnoses are not fixed. They change and they can absolutely abate. So perhaps at one time you had a diagnosis, but not necessarily right now. So it's not, that is not going to necessarily follow you from school to school or from work to work.
Uh-huh.
And then in terms of stigma, stigma is really, really, I think, a big roadblock for everyone. And it's really the belief that the fear of being labeled or prejudiced against. And typically there's two types of stigmas. One is social stigma, which is defined as like societal attitudes, like the attitudes of the societies in terms of mental health or seeking help. And they're usually prejudicial and discriminatory. And then perceived stigma is self-stigma. It's what you perceive, what your internal beliefs are. And that can be very limiting because it really stops your ability to get help. And it all thrives on secrecy, and we don't want that. There's nothing, there's no shame in getting help.
Right.
And that's what's important.
Yeah, it's interesting how you described that because I was thinking with many of the clients that I work with biofeedback, where I might put sensors on that are measuring, let's say, their muscle tension, and when they see it on the screen and it's relatively high, they're like, oh my gosh, it's it's so high, and I'm like, it was going on anyway. We just happen to be measuring it and making you aware of it now. So now we can work on it, and
Absolutely.
it's similar to what you're saying.
Yeah, absolutely.
So that's good. Now, tell me a little bit more, and not just me, but anyone who's watching, a little bit more about the actual program, the what you do as far as setting things up for someone.
So I'm hoping that I developed a fairly simple, easy to follow system. So it's really a 5 step plan. And I'm going to try to make it as concise as possible. So it's really a series of steps that allow you to do like introspective questions, like, questions about yourself and your family and what's going on. You will ask yourself questions that will guide you through your decision making in terms of what actions to take. And it will include identifying the problem. So really targeting on what's going on, what's the problem, reviewing your environment and how it contributes to what's going on, reviewing the home, the community, specifically addressing medical concerns, reaching out to medical providers, and learning more about the school, how the school interacts with your child, and really getting to understand you as a parent and how you contribute to what's going on. So
That
it's
that could be an interesting part of it. It again, a lot of times when people come in for, they're bringing a child in, let's say for ADHD, they may often not see the part that they play in it, and it's just the child has ADHD, and you just need to work on them. It's very interesting in how you're bringing them into it, and it's not just saying you're the problem or you're part of the problem, but just saying this is a complex thing that we're dealing with, and let's look at all the pieces and work all of them into the solution. It sounds
absolutely.
like what you're saying. So
Yeah.
continue. Sorry.
No, that's basically, you did a great synopsis of it. It's about being aware that everything is involved, and as a parent, you do have control and you do have power to make changes within all those areas that affect the child's behavior. So with the child working on their own stuff, and then parent actively working on their improvements, you should be able to see changes.
So you mentioned about like the community school, and you mentioned also you were starting to talk about the parent when I think I interjected, but you're mentioning about the parent, and I think one of the things you mentioned was about parenting style. And
Yes.
can you tell a little bit more about that?
Sure. So there are different theories out there, but there are 4 recognized parenting styles. So there's the authoritative style, the authoritarian style, the permissive style, and the neglectful style. In theory, it's argued that the authoritative style is the best style. This is when the parent disciplines appropriately, sets limits and boundaries and follows them, and enforces them appropriately. You want to be an authoritative style. I was raised in an authoritarian style, which is kind of like a lot of discipline, a lot of limits and boundaries set, and kind of like a no acts type of environment, which can work, but really mostly the authoritative style, it's the type of parenting style that you want to look for.
Uh-huh. Okay. And so now, just kind of going through the rest of the like how you put together a plan for someone.
Okay. So again, it's more about sitting down, talking to your child, and finding out what is going on with your child and what is it about you that bothers you. So what is it that's concerning you? Maybe your son doesn't, or your son or your daughter doesn't think there's an issue, but you do. Why? Then you're looking at, well, what pieces are affecting it, and really what the action plan is, it leads you through all these different pieces, and will ask you specific questions, and really there's a lot of questions there, but really the questions are infinite. It's really more to guide you in terms of the type of thinking that you should be doing when you're asking these questions. And then after each question, it's kind of like well, what do I do with this? So if so for example, if a child is tippy-toeing, well, is that an issue? And then asking your questions, well, why you think it's an issue, and then where do you go from there? Well, let's take them to the medical doctor. What does the medical doctor say? And then then there's like a cascading effect of actions that need to occur in order to feel better about what's going on with your child.
Well, I think it sounds like something that anyone who's working with young people it would be useful for them personally in their work, and also, of course, many people who are therapists also have children too, so it would be helpful in that way. And then I think also for the clients themselves. So often professionals will recommend other resources, and so I think your book would be something that would be very helpful to all of those people. So again, just tell people the name, the full name of the book, and where it's available.
Sure. So the name of the book is Understanding Your Child's and Teen Behavior, Simple Steps and Resources to Guide You Through the Journey. It's available on Amazon.com and on various bookstores like Barnes & Noble. It's also available will be available soon on Audible.com, and it's available on my website, which is angierumaldo.com.
Great. And your practice, are you accepting clients now?
I am accepting clients, yes.
And what would you say your sort of top few types of clients that you work with are? Like the
So
type of things that come in?
I have a mix of clients. So I try to target a few adult clients and a few children's. So most of the children clients that I see are usually behavioral issues, some depression, some anxiety, but a good bulk is behavioral difficulties. For adults, it would be anxiety and depression, and I do quite a bit of psychological evaluations. So I would say 50% of my time is spent with psychological evaluations.
Right. Okay. Anything else you wanted to add about the book, or a tip that you want to leave people with?
I think that what I've learned as a parent and while I was writing the book is patience. Being patient and really inquisitive is really going to help you go that extra step, go that extra mile. So that's what I would say.
Right. Well, it sounds like somebody might be calling for,
Yeah.
calling for a session, so
Yes.
we better let you go.
Okay.
So it was great talking to you, and I'm sure
Likewise.
we'll be in touch soon about other things. But thanks again, and I think definitely recommend your book to my audience of people that I work with, and looking forward to talking to you again next time.
Thank you. Thank you so much.
All right. Take care.
Bye.